Hello, what is sinusitis? Before we discuss about inflammation of sinusitis, let's about anatomy of sinus. We have four types of sinus that find within the bone. They are an empty cavity which is filled air and mucus. The largest sinus is maxillary sinus that find within the bone. There is also frontal sinus that find within the frontal bone, ethmoidal sinus that find within the ethmoidal bone, and the last one is sphenoidal sinus that find within the sphenoid bone. So the inflammation of this site is called sinusitis. So what is the cause of sinusitis? The cause of sinusitis, the most common one is viral sinusitis, viral cause, that is 98%, bacterial cause, which is 2%, and the least one is fungal cause. So those are microorganisms that can cause sinusitis. Allergic sinusitis that can stimulated by smoking, and there is also anatomical defect that block the discharge of mucus that produce within the sinus and can cause congenital sinusitis. So what is the types of sinusitis? There is acute sinusitis less than 4 weeks, subacute sinusitis less than 4 up to 12 weeks, chronic sinusitis greater than 12 weeks, and the last one is recurrent sinusitis, which is all over the year. So those are the types of sinusitis. The symptom of sinusitis, there is pain on the sinus area, headache, tenderness on the sinus area, and irritation on the sinus, and the sinus produce large amounts of mucus. That mucus can discharge through the nasal cavity, and the patient can develop nasal discharge. Have irritation, that irritation can stimulate cough, difficult to smelling, and the patient can have fever and headache. Those are the signs and symptoms of sinus. How to diagnose sinusitis? We can diagnose sinusitis based on signs and symptoms, based on fever, headache, and cough as well as nasal discharge. So that is sign and symptom of sinus. So we can diagnose sinusitis based on sign and symptom. And we can use an instrument that goes to the nasal cavity and we can observe the sinus. The instrument is called rhinoscopy. And we can do also X-ray. We can do also CT scan. CT scan, the diagnosis of CT scan is a definitive diagnosis. Treatments of sinusitis. We can treat acute viral sinusitis at home care. We can do home care for acute viral sinusitis, and we can give also different treatment like nasal decongestant to reduce the mucus production, to dilute and remove the mucus production, and we can also give mucolytic medication that's lytic the mucus and remove. We can appreciate the patient to take large amounts of water, and we can appreciate the patient to do well hydrated. The painkiller like paracetamol, ibuprofen to reduce fever and headache. We can add antibiotic if the patient who has bacterial sinusitis. If the patient who has chronic sinusitis, we can give antibiotic for the last 10 up to 40 days. Or we can do also 4 up to 6 weeks. For severe sinusitis, we should consider surgery. Thank you very much. This is all about sinusitis. Have a nice time.